if you can get universal health coverage, then you can raise the bar on all of the health issues. You get that cross benefit going. You actually can make your health system more resilient should an emergency come up. You can actually catch a disease outbreak early if it happens, or perhaps keep it from spreading. You're going to see another example in just a minute on how this can help, and that's going to be with non-communicable diseases, or at least that's what the public health world calls them. People like you and me would call them chronic diseases or lifestyle-related diseases, but we're basically talking about things like cancer, heart disease, stroke, diabetes, chronic lung disease. These are the things that really are lifestyle related and habit related, and they are the leading cause of death all over the world and also in this region. In fact, in this region, each year 1.7 million people die from these types of diseases. They can be prevented, they can be managed better, and we're going to talk to two guests about how that can be done. Joining me now, Dr. Ali bin Talib Al-Hinai, the Undersecretary for Planning Affairs at the Ministry of Health in Oman, and also Judith Mackay, Senior Policy Advisor to WHO and an international tobacco advocate. Dr. Al-Hinai, let me start with you if you would. Many people say that Oman was on the front end of addressing non-communicable diseases. What was it that caused your country to recognize the problem so early? Use your microphone if you would.
Oman started to become a modern country in 1970. And since then we have had a 5-year development plan, including for health. And the government focused really on building a robust health system with emphasis on primary health care in collaboration and partnership with WHO. And the second thing also, we started very early to have good information, health information and statistics, which help us really to discover the prevalence, the incidence of many diseases, including diabetes and hypertension. And therefore, we have the opportunity to put our plans for the future.
So tell us a little bit about the primary healthcare system there, and how is it set to reduce the risk of non-communicable diseases?
Primary healthcare considered to be the first point of entry to our healthcare in Oman. And we have our own criteria that each health center serves around 10,000 population, although we have some centers, health centers providing service to less than 1,000, and that's due to social demands and so forth. The number of visits really per person, per citizen in Oman right now is around, in the average, around 6.25 visits per year. 4 of these are into our health centers and our primary health facilities. Based on that, our health centers provide services to mothers, children, elderly, as well as it provides services for non-communicable diseases like hypertension and diabetes. So that's why we have this kind of primary health care, which we think it covers almost all regions in Oman, especially the remote areas and those areas which we think it is very difficult to get some health services there.
To what degree can you say how much it has helped reduce the problem of non-communicable diseases?
For example, like diabetes. Diabetes, we have diabetic center in the capital, but the criteria, the standards, and the action plans, really, it is implemented in the health center. And we usually monitor for example, the percentage of control of diabetes, and also percentage of recruitment of diabetic patients per year. And there is some kind of improvement on that, although still we have long way really to achieve what we want to achieve in that.
If another country was interested in modeling after this setup, how would you advise them? What advice would you give them to set something like this up?
The first thing, they have to have the primary health system in their country, which really springs from their culture, from their economic and social needs, and they do not need to copy and paste the others. That's number one. The second thing, they have to start taking care of providing services to children and to mothers. That's the most important thing for them. And then we expand the whole services to the for elderly as well as, for example, our health centers, in some health centers, which is usually in the cities, we provide home visits to those patients who cannot come to the health facility. So this is, for us, it is new, but it is, I think, very productive.
I think that's a very interesting point that you brought up there, that it's not a one-size-fits-all model.
Exactly.
That each country needs to look at what they need and what they can bring to the table to set up a similar thing. Dr. Al-Hinai, thank you for your time on that. Just stay with us for a moment, if you would. When it comes to non-communicable diseases, one of the biggest risk factors is tobacco use. And this is your specialty, Judith. Talk a little bit about tobacco use in this region. How great is the problem?
Well, at this very moment, it's a very big problem in the region, and it is set to get much worse. I mean, that really is one of the take-home messages that we've been discussing at this meeting. At the moment, about 20% of adults in this region smoke, and in another couple of decades, it'll be 25%. And we only have to look at youth smoking to realize that the region is set for quite an explosive expansion in terms of smoking.
And what is driving that? Why is that? Because it seems like smoking is going down in other parts of the world. You say it's going up here.
Smoking is going down in most parts of the world, but in the African region and in this region, it is destined to go up. And there's a combination of factors. It's that young women are becoming more independent and they're beginning to smoke, particularly shisha. And there is greater economic ability of teenagers to buy tobacco. The tobacco industry have certainly moved in with a lot of promotion in many different ways, advertising, sponsorship and promotion, encouraging young people to start smoking, even though they say they don't promote to children, they do.
So talk about what countries need to do in order to reduce this problem.
Well, the interesting message is that what needs to be done is almost the same in almost all countries. The main thing that drives smoking rates down is higher taxation. And it's simply because it puts tobacco out of the hands of young teenagers. It's an affordability issue. So many people would say, if you want to reduce smoking, the message is tax, tax, and tax. But of course, there needs to be legislation as well. There needs to be smoke-free areas, and that needs to be enforced. There needs to be complete bans on tobacco advertising and promotion and sponsorship and the behavior of the tobacco industry. There needs to be very robust health warnings, pictorial health warnings, and in fact plain packaging where almost everything is taken off the pack that makes it attractive to children. So WHO knows very well, through the Framework Convention on Tobacco Control, the best buys, and these apply to, in fact, all countries.
And they really make a difference.
They really make a difference. If every country in this region were to implement the Framework Convention on Tobacco Control, the rates would, in fact, come down.
Terrific. Thank you both for coming by. I appreciate your time talking about ways that we can manage and prevent non-communicable diseases. Thank you both very much. One of the things that Judith was mentioning there was the increase in young people who are smoking. Study after study after study shows us that people who start smoking before they are in their early 20s will continue smoking into their adult years. If you can keep people from smoking before they turn to their mid-20s, then you can probably prevent them from ever picking up the habit. And it is one of the habits that really is linked to so many of these non-communicable diseases. It's one of the habits that actually kills about half of the people that pick it up. So well worth avoiding if you can.